We want to say hello. My name is Dr. Mandell. We're going to touch on some very important things today. It's about stress. It's all about the ugly stress that affects our brain, our heart, and our body. We are streaming live right now. I want to talk about the importance of understanding stress because there is no question that stress is all tied into disease. Everything that goes on within our body is directly tied into stress one way or another because the body is tied into one common denominator called inflammation. And obviously, these particular hormones secreted from the body induces inflammation. Now, we are going to have stress, and stress is a normal physiological part of our lives. In order to deal with life, we have to have stress, otherwise we would not be able to survive. Although, when we stay stressed, these are the conditions that we're going to talk about right now. So, once we get stress under control, you are going to definitely stay healthier and live a longer life. Now, realize that when we're under stress, there are hormones called stress-related hormones that are related from the brain that release adrenaline, norepinephrine, noradrenaline, cortisol. And these produce physiological changes within the body. And when this happens, you have a whole bunch of effects that start to occur. For example, our blood pressure rises, our pulse rises. We start to become more keener as we focus a lot more. Our digestion obviously is not going to be the best, but our muscles start to fill up with blood. We go into this stress response where adrenaline is being secreted. We have insulin being secreted because now we have glycogen that's releasing sugars in the bloodstream so we can get energy. The problem with this, we call this the fight or flight. The sympathetic nervous system is releasing all these hormones so we can deal with the stress. But the problem is, if we deal with it and then it goes away, it settles back down, we're perfectly normal. Kind of like you're in the woods and you see a lion running after you, where you're going to have this sympathetic, you're going to get all this oxygen, you're going to get these muscles filled with this all energy so you can run and run. But once he goes away, we start to calm down to normal again. So what we're talking about is that when we don't calm down and we continue to have this trickling effect, like the coffee trickling from the coffee maker, like adrenaline's trickling from our system, this is where we start developing sickness, disease, weakness in the immune system. So we realize that if you were going to take a test, okay, or you were going to go for a job interview, you will have these stress hormones being secreted, but it will start to rebalance. Once you're finished with the test, once you're finished with your stress that you have to deal with, or your meeting, the stress calms down and then we're back to normal again. But when it doesn't calm down, this continuous activation, this is what causes wear and tear of the body. When we look at the respiratory system, when we're stressed, we start to breathe harder. We start to breathe quicker. We then start getting this oxygen-rich blood moving throughout the body to give us this energy. But the problem with this, if you are asthmatic, if you have COPD, if you have any type of respiratory problem, you may potentially have a condition that can flare up with you and cause serious issues. For example, an asthmatic attack. It's all tied into stress. You've already have the weakness, now we're having the hormones that's not allowing this weakness to be efficient. So this can lead to hyperventilation. People who are or have anxiety. When you're under stress, guess what? Your anxiety comes out more. It affects your thinking. It affects the brain. It affects your nerves. You become short-circuited. And we start becoming who we're not. Stress can play funny games. The old panic attacks tied back into stress again. It affects our immune system. This cortisol that's being released in our body, it suppresses the immune system and the inflammatory pathways, and we become more susceptible to infections, to chronic inflammation. Our ability to fight off illness becomes reduced. In other words, our system is becoming weaker. In other words, all the colds, all the flus, all the sicknesses that you're catching is a result of stress because it's weakening your immune system. Your musculoskeletal system, your muscles, they become tense. I invite all new people out there who are just tuning in, check out my channel. You'll see so many conditions that are related to neck pain, back pain, spine pain. Because when you're under stress, the muscles contract, they shorten, they pull up, they tense. You get the headaches, the contraction, the achiness, because muscles are a protective mechanism from the stress. In other words, the adrenaline is causing the muscles to contract, is causing it to shorten. And then when this continuously stays shortened or contracted, we start becoming achy, inflamed, pain, radiation on the nerves. It affects our shoulders, our necks, causes tension headaches, causes migraines. So it does affect the musculoskeletal system. People get massaged, they say, oh, wow, you are inhibiting or not allowing the body to continue to secrete epinephrine and cortisol. That's causing the muscles to constrict or contract. The cardiovascular system, the heart, it increases the heart rate, increases the blood pressure. It causes vasoconstriction of the vessels. When this happens temporarily, it's okay. But when it continually happens, this leads to hypertension. It leads to heart attacks. It leads to strokes. It leads to conditions because the BP is skyrocketing and never comes down because that cycle has never been back to normal again. It just continues to trickle. So these are the things that we need to be aware of, and these are the chronic conditions that cause ill health. The endocrine system. This is the system that plays a very important role in regulating your moods, your growth, your development, your tissue function, your metabolism, your reproductive processes. This plays a key role between the endocrine system and the nervous system. The nervous system is the most important system because that controls all the systems in your body. But the stress signals coming from this, it comes from the hypothalamus up in the brain. It releases the stress hormones, cortisol and epinephrine, and then the blood sugar glucose is produced by the liver to provide you with all this energy when you're in a stressful situation. But most of this sugar and most of these hormones are absorbed when they come back to normal. But for those that are not absorbed, the sugar stays elevated and you become a risk for type 2 diabetes. Stress affects the unpleasant gastrointestinal effects. People who have chronic heartburn, chronic hyperacidity, chronic reflux, a lot of this is not all coming from your foods. It's coming from chronic stress. You can take all the Previses, all the Tagamins, all the Nexiums, all the proton pump inhibitors, all the H2 blockers. If you don't get that stress under control, it's not going to go away. It's going to affect your digestion, going to affect the assimilation of foods. We talk about all these good nutrients and vitamins that's healthy for us. But how can those nutrients do its job if we're not allowing it to absorb from the stress? Because the gastrointestinal system is going to cause IBS, irritable bowel syndrome. It's going to cause stomach pain. It's going to make you feel bloated. It can give you constipation. It can cause nausea or even diarrhea. Now, what about the reproductive system? Men, you're going to appreciate this because this is the truth. That's why men have a hard time getting erections. That's why they can't perform with their women, because stress is not allowing the normal effect to take effect with the normal testosterone, which is affecting the sperm. It affects the erection. It affects the blood changes that goes on within the penis. And then the woman, you're talking about menstrual cycles, menstrual problem, menstrual pain, premenstrual symptoms, all from stress. You'll be surprised how much this is affecting your system because of stress. Now, your mind, as I said, you become hyper-aroused, you become anxious, you become irritable, you have difficulty falling asleep. You're affecting the cortisol levels because obviously the cortisol levels are highest in the morning. They start to get lower in the night, but they become high again in the night because of this excess stress. the extra worrying, the tension. You have physical stress, you have mental stress, you have emotional stress, but stress all comes out the same way. So realize that all this research is linked into poor sleep. When you have poor sleep, it affects your chronic health problems, it affects depression, and it will lead to obesity. Now, if you're under stress, I recommend highly cut out the cigarettes. Don't start drinking to cover up your stress. Don't start continually just take drugs because it's something that may make you cope better in life. Because in the long run, you're not going to beat it. You're going to have lots of problems. We need to learn how to manage stress, meditation, exercise, good nutrition, biofeedback, yoga, having correct sleep, being around positive people, working on positive affirmations, and staying away from negativity in your life. If you hang around negative people, you're gonna be a negative person. That's not going to help you. So we can't afford to have that extra baggage within our lives because we all have stress. Understand, there's no perfect human being in this world. Regardless of where you are, I don't care if you are the most famous movie actress or actor. I don't care if you're the president of the United States. You will have stress. And the biggest obstacle in life is dealing with the stress, is not letting it put you down into a corner, not letting it take sleep away from your life, not letting it affect your life in any way, but finding ways on dealing with stress. That's another program. I just wanted to bring this out to people to let you realize that a lot of symptoms, most symptoms that people have today are tied into stress. It affects the heart, it affects the mind, and it affects the body. So I hope that this gives you a little bit of understanding about yourself, that you can say, you know what? I'm facing all these problems. I can't afford to be sick. I have a family. I have kids. I have a mother who's sick. Whatever your situation is, we all have situations, but we need to manage them better because we can't let stress take over our lives. It will weaken us. It will deplete our immune system, and it will make us sick. So, on a good note, let's stay healthy. Let's stay happy. Let's continue to stay proactive. Chatters, I really want to send a lot of love to you. I appreciate you being here. I know you're here, but because of the fact that we put this on the program and this is being recorded and many of our other subscribers and people out worldwide are going to see this video, I just want to say blessings to you and blessings to everyone. If you are a new video listener here, or if you have not subscribed, I ask you to, because stay with the cutting edge. I'm there with you. Check out Motivational Doc on Facebook. Motivational Doc on Facebook. You can leave your questions over there as well. I'm going to go to the chat room after this, and I'll go ahead and answer a few questions. I want to send a lot of love to you, your families, and loved one, and just keep staying proactive. Just keep fighting each and every day, but keep that attitude positive. Don't let that stress bring you down or take you down, and stay away from those negative people. They're poison. You can't afford that in your life. Anyways, I want to say God bless you and have a wonderful day or night wherever you may be right now. And we'll catch up with you real soon. You know we will. Okay, bye-bye now.